I am a candidate on record in support of single-payer health care, period. So, no bones about it, no mincing words, and I came out several months ago to say that my dad is a retired doctor and my mom is a retired nurse, and my dad was internal medicine. So, I know the front lines of medicine, the excruciating work that's involved. He used to take care of patients and meet with them for half an hour, 45 minutes, an hour. There's no way you could have a quality medical practice in this day and age where corporations and giant healthcare companies and hospitals run everything. And the time is now. You don't start fighting for something when it's politically expedient. Women's suffrage taught us that. The civil rights movement, it took decades. It took women 60 years to get the vote. If they had waited until it was possible, we might still be waiting. If the civil rights marchers and Martin Luther King had waited until it was, appropriate to start asking for the right to vote and to desegregate, we'd still be sitting around waiting. You start the fight now, and it is going to be messy, and it is going to be long, and it's going to be a slog. But if we don't start now, we are going to be in the same place 5 years from now. And the economy and healthcare are inextricably linked, so we can't take care of one without the other. And we have to tell people over and over again, we spend $7,000 to $8,000 per capita in this country on healthcare. The other countries that are closest to us are Britain, France, and Canada, and they're all no higher than $4,000. Yet we have higher infant mortality rates. We die sooner, we have higher rates of diabetes across the board. Our healthcare, we are not getting what we paid for. So we are paying for it one way or the other. And people are scared, they think it's going to be government-run healthcare. It's not. It is still private doctors, it's just single payer. And yes, they're going to pay through it in taxes, but they're already paying through it in taxes through emergency medical services and everything else that we fund from Medicaid and Medicare. So Democrats need to get real about that. And if they start the argument now, we might have a chance of winning. They made the mistake with healthcare before. They should have started with single payer. We would have ended up with public option. But they started in the middle, and they ended up on the bottom.